of the International Pharmaceutical Federation. The International Pharmaceutical Federation is the global body representing over 4 million pharmacists and pharmaceutical scientists. We work to meet the world's healthcare needs. FIP is an NGO that has been in official relations with the World Health Organization since 1948. The Community Pharmacy Section's mission is to assist pharmacists wherever they live and practice in the delivering of medicines, health products, and services that will improve medicine use and advance patient care. The Community Pharmacy Section Executive Committee aims to unlock pharmacists' full potential so that we all can deliver maximum value to our patients and healthcare systems, thus contributing to the objectives of the health strategies of the countries. Consider joining FIP as an individual member at FIP.org. So today we're having our 2021 Champion for Change, and Dr. David Odhiambo answered a call that we sent from the Community Pharmacy Section, trying to gather information, trying to foster innovation, trying to identify champions for change. And Dr. Odhiambo answered with high detail and with very comprehensive information, these questions that you have on your screen. What service pharmacists should offer patients and or healthcare systems to help tackle the mental health burden, which of course has increased dramatically through all over the world because of this very sad and hard pandemic we are all still living in. In what ways can pharmacists support self-care and mental health patients having a more autonomous life? And lastly, very important, about the use of digital health tools, either low or high tech, that can support community pharmacists to improve outcomes and better support patients with mental health problems. The Champion for Change 2021 received a stipend of €250, 2-year FIP free membership, and the chance of communicating his vision through today's webinar that have us today listening with a lot of interest. So it's my pleasure and honor to introduce you to Dr. David Odhiambo, who's a pharmacist with a passion for and commitment to improving access to quality healthcare services for all and nurturing socially responsible generations through his vocation. He is a regulatory affairs associate with Novartis, the pharmaceutical company based in Kenya. He doubles up as co-founder, Reculture Health and Social Innovation, a social enterprise committed to improving access to quality healthcare services and promoting human capital development in Africa, and Curator African Pharmaceutical Network, which is an initiative working to mobilize pharmaceutical industry players in Africa for knowledge sharing, policy shaping, and innovation nurturing discussions in efforts to improve access to quality, safe, and efficacious healthcare products and services for the African people. Today's webinar is being recorded, and FIP members will have the chance of seeing it in the private part of the website. And you will all receive, which I understand you're very much interested in this information, you will all receive a personalized certificate of attendance today or tomorrow. So it is my pleasure to give you the floor, Dr. Odhiambo. Please, all the attendees have the chance of send questions through the Q&A box, and we'll have 10 or 15 minutes at the end of the webinar to go through them and having our speaker today answering them. Thank you, Dr. Odhiambo. The floor is yours.
Thank you so much. And thank you, Heme, for this particular opportunity, and everyone who has joined us. I hope we're going to learn and we're going to discuss as we look at what are the possibilities of how pharmacies can engage in terms of improving access to mental health services in our areas of practice. And for this particular opportunity, one of the key things that I looked at in terms of this presentation would be structuring it in the different components, and the different components in the sense that we have 3 sections of the question. So one of the key bits for me was what can community pharmacies deliver in terms of mental health care services? And on that account, I was keen to look at what's mental health generally. So we understand that mental health is a state of well-being in which every individual realizes his or her potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to contribute to his or her community. That is a definition according to the WHO. And when we look at it from that dimension, we realize that mental health spans all the continuum from good health, that is, you are in the best mental health status, they're able to perform as per the description and the definition by the WHO. On the other scope, we could go to the other extreme where you're now having mental illness, that is the ill health, ill mental health. So across the continuum, we come from mental distress, we have being uneasy, psychosocial distress and all, up to the extremes. So within that scope of care, what are the services that a community pharmacist or a pharmacist can deliver? And one of the key bits when we look at it from the dimension of COVID-19 and all that we're dealing with at the current moment, we do acknowledge that there is a burden of mental health that has been growing tremendously over the years, over the time. And this has been contributing either by the political tensions and social anxieties, economic challenges and all related, including climate change when we're looking at all the challenges that we're dealing with at the current moment. When you look at all this scope then, the question is, how do we ensure that we are able to support the patients who depend on and rely on us to offer the mental health services that they need? So the key bit at that point is to look at what are the challenges. And the challenge that we have currently is access to mental health practitioners has been a challenge. There are a limited number of these professionals, and therefore we have to look at how do we prioritize on terms of task shifting and even task sharing arrangements within the practice. So where do people access healthcare services? Where do people seek these care services? So when I looked at it from a pharmacist perspective, and as a pharmacist who believes we have a role to play in this space, having been in this space for the last 3-4 years now, from 2017, I looked at it as the most used access to care, the most used point of care seeking for the general public has been community pharmacies. And in almost every other publication that you look about accessibility of pharmacies, you'll realize that we're talking about the first point of contact with the healthcare system being a pharmacist. On the other end, when you look at access to healthcare services from a hospital setting, the last point of contact, after a prescription has been written, the patient will always go to the pharmacy to get their medication. So across that continuum from being the first point of contact to the last point of contact, what interventions can a pharmacist deliver? What services can the patient and the general public access from the community pharmacy, especially in terms of promoting their mental well-being and ensuring they're able to thrive rather than surviving in such kind of dynamics? So in this particular slide that I'm sharing with you, through the work that I do with Agriculture, Health and Social Innovation, we partner with Planet Wizard, a media publication company. So when we did that survey, it was just a general survey to look at what is the general public's perception on the role of a pharmacist in providing mental health services. So the first perception in terms of access, the general public felt pharmacists had 88.2% of them felt pharmacists have a role. For the pharmacists, 100% we felt we had a role. Then on the other end, when you look at your left side of the screen, you look at it in terms of the findings into what pharmacists, whether pharmacists are equipped to offer mental health services or not. On one side, the general public felt like we are equipped, up to 42.9% of them felt we're equipped to offer mental health services. When you look at the pharmacists who responded, only 37.5% felt we were equipped. So therefore that shows, one, the general public believes we have a role to play. They're willing even to uptake of these services from pharmacists. But on other end, when we look at ability to deliver and the level of being enabled to offer these services, the public even had a higher rating. So generally, the main reason as to why I share this is we have to acknowledge we have a role, which is good from the presentation that we all acknowledge we have a role. On the other end, the general public believes we have a role and they're willing to uptake these services from us. So then the next bit would be equipping each other to be able to deliver these services and to serve the communities who depend on us and rely on us delivering these services. So on that account, then I looked at it in terms of what are the key services that we can offer as pharmacists to the mental health services. So first of all, I'm not going to follow the order in terms of how these services have been listed, but the first bit we have to acknowledge is healthcare service delivery is a continuum from disease prevention, health promotion. We have curative, rehabilitative, and palliative services. So the first point of contact, we need to look at it from the policy advocacy and general well-being promotion within the communities. That links to the last point in this slide when you look at policy advocacy. So we have to position our community pharmacies as wellness centers. do we offer the public services that they need? When somebody is coming with distress, let's say, for example, in a community over the COVID-19 period, people needed answers, but they didn't know where to access these services, these answers. You as a professional within the community pharmacy setting or in a hospital setting, when they come to you, are you able to give them the information they need? And if you're giving that information, are you giving them the reassurance that they'll feel they have a way to deal with the anxieties that they're facing? That is the first point of care. Then other than that, you now look at it from what interventions can we provide for the general community? There is the resilience measure, the support during COVID-19 in terms of financial rebates and all that. Can we take a key advocacy role in championing for government interventions and investment in providing mental health services? Let's say, for example, clinics that are able to offer mental health services. If not the clinics, can we partner with mental health clinics and mental health facilities so that we can offer referral services? And that is coming at the signposting. And the key bit is at the initial point, before you signpost or even refer a patient, you have to acknowledge that I have the technical capabilities as a pharmacist to identify somebody who is having mental psychosocial distress or having a mental illness. And therefore, once identifying, I need to evaluate on scaling from mild, moderate to severe. For the mild and the moderate, majorly the support that is needed, psychosocial support, counseling, therapy, and all that. So at that level, am I able to offer that? If you're not able to, we need to look at how do you equip yourself to be delivering. So the scope of services, one, you have to be able to identify and diagnose. For if it's mild to moderate, you can offer psychosocial support and counseling therapy. After that initial phase, you can now, if it's somebody who has a severe condition or need to see a specialist or a practitioner with an advanced level of care, then you are able to refer them. That is a key bit in terms of offering the mental health care services. On the other bit, we look at it in terms of what are the other contributing factors. Generally, when I'm unwell, even with some of the physical conditions, I would need to have access to my medication. I need the reassurance. And it affects my psychosocial well-being generally. I'm stressed because I'm sick. And that is a mental condition that needs support. So as a pharmacist, being medicines experts as we are believed to be and we are, then we need to look at it from, am I doing the medication review to ensure the patient derive maximum benefit that does not affect them? Am I reconciling these medicines? For example, one of the key bits that I was keen about is anxieties come with palpitations. And at the same time, somebody who has cardiovascular conditions might be experiencing palpitations. So when you are dealing with medicines for such kind of a patient who has both conditions, they need to be keen on, am I giving them some medication that might actually exacerbate one of the other conditions, or am I giving them the most optimal care that will lessen their symptoms and improve the outcomes for this particular patient? That is on medication review. Then two, at the point of dispensing your medication, adherence counseling is a critical bit, but before patients can follow up on the use of their medications, they need to get assurance that it's the best medicine for them. And in case they feel any of the symptoms that I'm mentioning, for example, anxieties and cardiovascular conditions, you can make them be aware that these are possible side effects of this drug. And therefore, it doesn't mean that the drug is not working for you. It means that is a probable side effect of it, and you need to continue using it to derive maximum benefit from the use of this medicine. If you're able to do that, the patients will derive maximum benefit from the drug because they'll continue using it as per the prescription, as per the treatment schedule that you've agreed with him, and even other practitioners if you're working in a multidisciplinary team. And therefore, you are ensuring the patient derives maximum benefit and is able to achieve the ultimate positive outcomes that we desire. Then we look at the general disease care, counseling, prognostic support, and patient advocacy. General diseases, generally, one of the things that I mentioned, even medication review, we have patients who have challenges, and with physical diseases, mental problems, psychosocial distress, and all that. So you need to be able to guide them across their patient journey. And if you're able to do all that from prevention aspect, health promotion, got them up to the end of it, that for those who are sick, when we mention the aspect of policy advocacy at the last mile of care, these people are already sick. Maybe access to mental health services is a challenge because of the financing. How can you engage as a pharmacist, as a practitioner, to advocate for the financial institution, let's say, for example, capitation and insurance rebates, so that they're able to access their medication? Being a pharmacist dealing with medicines and you understand the cost of it, when you come to a policy discussion engagement level, you are able to build a case on why the government or financial or insurance agencies should be able to pay for the mental health services and even the medicines that the patients need. If you're able to do that, therefore patients are able to afford their medicines, to access them. Because when we look at the overall continuum of care, we look at it from affordability, access, and the quality of services. So those are the all different aspects, and you have to advocate for it from a point of, this is a patient who needs my ultimate, utmost best care. And I'm going to enable them to be able to access the best, highest quality, affordable care that they need to alleviate or even to manage their condition. And if you're able to do all that, we are able to advance access to mental health services. And it starts from the advocacy, just engaging within communities, to treating them, to managing them, engaging with others, referring them. So those are the scope of service that I feel as community pharmacists, as pharmacists, even in other areas of practice in a clinical setting, we are able to offer. Then the next bit for me is pharmacy support for self-care and autonomous life. We do all acknowledge that being individuals, we want to have control on how we live our lives and how we run our affairs at individual level. And if we are not able to do that, there will be some level of deficiency. I want to maybe travel, enjoy, get my work, as was mentioned initially. I work for Novartis. I want to go to work every single day and feel like I can control my life, I can contribute to my well-being and every other person that depends on me. If I'm not able to, because I'm maybe domiciled in a particular facility, healthcare institution, then that will be affecting my mental wellness. So therefore, the link between mental wellness and the self-care aspect is the fact that we need to be able to support patients who have mental illnesses to live an autonomous life, to live without being dependent on others, and to make decisions that enable them live healthier lives. And I took a definition from the Global Self-Care Federation that mentioned that self-care is the practice of individuals looking after their own health, using the knowledge and information available to them. And therefore, in this case, when you look at it from a pharmacist perspective, the key role that you have is, can you enable them have access to this information? Can you give them the knowledge so that they make the right decisions? And if you're able to do that, you're guiding them towards being able to lead autonomous lives. And therefore, when I look at it from pharmacists can support them, yes. And how do we do that? We have two key pillars. The first one is using digital technologies. Over the face of COVID-19, we've all acknowledged that digital health solutions and technologies have a critical role to play in how we deliver and how we access healthcare services. Some of the key aspects have been on e-pharmacy, teleconsults. We have digital patient support networks, remote monitoring of patient parameters and all that. So when we look at these digital technologies, as a pharmacist, based on the services that I've mentioned in the previous scope of intervention that you can deliver, where do you come in? The key bit is, maybe you have a patient who has a mental disorder, who is mentally ill. They need their medicines. Can you coordinate e-pharmacy delivery so that they don't have to be traveling every other single day to come out to your facility to get it, but you can coordinate that they have the prescriptions being filled electronically and being transmitted to them. That will enable them to continue with their errands, every other thing that they want to pursue in their lives. Two, in terms of management, we have the therapy monitoring aspect of life. And in terms of therapy monitoring, we can engage in terms of assessing the patient parameters. How are they performing? What are the blood levels of their products and all? Or the particular drug they're using. Can you counsel the patient? For example, when we talk about psychotherapy and psychosocial counseling, can we have Microsoft Teams or even Zoom calls with the patient, engage with them and understand how they're progressing, whether they're getting better or their challenges that they're experiencing, and guide them on how to get the best support they can get. And one of the other things that we acknowledge in terms of mental health support, a key bit is ensuring that patients have a support framework. And when you look at, for example, the communities you'll have, for example, the Alcoholic Anonymous, drugs and substance use is also related with mental disorders. And these are normally through patient support group. They feel somebody goes through the same problem they're going through and is willing to work with them in that journey. But normally these have to be coordinated by an individual. Imagine if as a community pharmacist working in your space of work, you've diagnosed a couple of patients who need some psychosocial support or even counseling under some medication as well. And we establish a digital patient support network using even the low-tech technologies like WhatsApp group, a Facebook page or a Facebook group, where they can share their experiences. By sharing their experiences, they get the reassurance that they are not unique outliers in the continuum of mental health care. There are people going through the same experiences, and there are people willing to share and walk with them through that journey. You are supporting in terms of their mental health care, and therefore they don't have to be domiciled within the health facilities, but rather they can live their lives without feeling inadequate in some particular way. And those are some of the key interventions when you look at adoption of digital technologies to support patients lead the best of their lives from wherever they are. Then the next bit is looking at it from, as patient advocates, how can we ensure that patients can live autonomous lives? And that is one key that I'm going to refer you to, the WHO Quality Rights course. It's a 4-module course that you can look into and look at how do we champion for rights-based approaches to healthcare delivery, especially in mental health services. And the key bit that we need to be keen on is, oftentimes in terms of the mental health care models that have been working, anybody who has been diagnosed with a mental disorder has always been considered to be either they're aggressive individuals or violent, and most of the care has been refined or constrained to within the hospital settings. Some of them are changed, and these are cases that have been documented in other different forums and all. So can we champion for their patients and look at them as individuals rather than patients? Because once we see them as individuals who need care, we're able to guide them and support them in that care continuum. And we're able to let them live with their communities, live with their families, rather than being restrained within institutions, unless it's necessary to restrain them. And even when we restrain them, are we restraining them in humane means, or are we restraining them from a prohibitory mean, or rather, I would say, kind of challenging them in terms of their care? If you're able to champion for their well-being, they're able to even comply. Let's say, for example, if rather than admitting them in hospitals, we can let them be visiting the facility after 2 weeks, going for their clinic days and monitoring and follow-up. That would be good for them because they're able to integrate with their communities. As we acknowledge, the social support network is important for our mental well-being. And if we take them away from the community that is supportive enough, the family setup that where they exist, we are denying them the supportive environment that they need to get. So as pharmacists, knowing patients, knowing their disease state, and being able to walk with them that journey, can we transition and get them to be part of the framework? Can we speak on their behalf? Because at the end of the day, probably somebody would not, or even some of the decision makers and all, might not listen to them because they feel probably their reasoning and judgment is compromised because of their disease state. But you as a professional, you as an individual who understands their challenges, can you speak on their behalf? Because at the end of the day, these patients count on you as the practitioner, as the professional, to speak on their behalf and to defend them, to ensure they get the best care. So when you look at all those, there are areas that we can support the autonomous care, autonomous living for the patients that we have. And we need to deliver it by looking at the patient as a person and looking at what is the expectation of us and delivering on that mandate. Then I'm going to go to the third question that I had, digital health solution in advancing self-care and mental health care service delivery. I've mentioned part of it when I'm looking at the aspects on how we can promote self-care and autonomous living, looking at the e-consult, telepharmacy, teleconsults, and all that, which are critical bits. And we have to acknowledge over COVID, there's been a growing trend in terms of use of digital technologies. And even now when we look at it, from WHO to the biopharmaceutical industry, every other person is looking at how do we employ digital technologies to deliver healthcare services within the different frameworks where we practice. And the focus has been on convenience for patients. I want to be able to access care without having to travel. Digital technologies are going to enable me to do that. It has to be affordable. The cost of traveling is even prohibitive for some people to go to hospitals. With digital technologies, for example, Zoom calls as we're having now, it enables us to be able to access the care with what we cut on the costs that are involved in that and the quality of care. And when we look at quality, being pharmacists and medicines experts, we know the main critical bit in terms of healthcare service delivery, part of it is in the medicines. And one of the bits that we have a challenge with is falsified, substandard, and counterfeit medicines. How do we use digital technologies to safeguard our pharmaceutical supply chain to ensure patients have access to the right quality of medicines and are able to derive maximum value from them? So those are some of the key things that we need to look at from how do we apply digital technologies. So key bit is, can patients achieve the positive treatment outcomes and improve quality of life for them? So the touch points, we have two aspects. The low-tech digital solution, those are the ones that I was mentioning. Having a WhatsApp group that you can chat with people, share in stories and converse. Facebook page groups and all, can you engage with them? Telegram. So these can have the patient support group, a social support network where you have people undergoing the same experiences. And one of the key things that I just need to mention at that point is, when you look at the approach to mental health services and even any other disease, the focus has been on lived experience leadership, where we need people who are going through the same challenges to share their stories, to guide the interventions, because we are looking at human-centered design. And if you get to look at the Wellcome Trust website, they have a project that is working on promoting mental wellness. And when you look at it, they're key on how are we bringing in the voice of the people living with these disorders. And as a community pharmacist or as a pharmacist, you can be able to put the patient's needs into the framework or how you're delivering care, and even engage with other practitioners within the ecosystem to ensure they derive maximum benefit and they are getting perspective that they might not have accessed, because you work where patients come to you as the first point and the last point. When I come to the hospital and I get care from the doctor and all that, at the end of the day, the most critical information that I take is, what do I get from the pharmacy? I need the medicine. So with the patient, the pharmacist gives me more information with the medicine they're dispensing to me. It has more impact than any other area. And that is where patients actually share more information at the pharmacy rather than in the other areas of care. Why? Because they have that level of trust. And looking at last year's celebration of International World Pharmacist Day, pharmacists, we are trusted stakeholders in the healthcare space. And we can leverage on that trust to be able to support patients in their care journey. So that is where we now come in. Ensure we have the digital technology that are supporting patients. Then two, pharmaceutical supply chains, as I mentioned. We have challenges in quality of medicines, substandard, falsified, and fake medicines are coming into the markets. If we had an integrated end-to-end pharmaceutical supply chain, it would mean that any medicine that's getting into any particular territory is of the right quality, is coming from an identifiable producer or manufacturer, it's going through the chain, ultimately to the patients who need them. And if that happens, then we won't have influx of the substandard medicines. And majorly some of the products that are being targeted would be these psychotropic drugs and all that are treating mental disorders. Reason, some of the costs of procuring these medicines are prohibitive and they're high, and therefore the unscrupulous dealers within the supply chain would look at them as easy targets because most of the governments are not focused on them. Most of the regulatory agencies are not keen on them. And therefore, the patients who need them must find a way to have them. And therefore, they are willing to buy whichever way it has for them to get the relief they need. So can we be able to secure that supply chain? And on that account, I'm keen on can pharmacists share our knowledge within the ecosystem to design an inventory management system that is linked to patient automatic refill reminders as we talk about the e-pharmacy? Can we link that so that I can trace your medicine from the point of production to the end patient, such that in case of a challenge, there's that traceability, and we can even initiate recall system that reaches to the patient by following the chain that it had gone through. So that's another bit that we can deliver services and actually optimize access to quality healthcare products for the patients. Then integrated health information management systems. Most of the times, the challenge with delivering care is I have limited information based on what the patient gave me. But on the same note, you can realize that the patient gave a lab technician different information, the medical lab person, they gave the clinician or the physician a different set of information. And if they were referred to a mental health specialist, they also gave more information or even a different set of information. So if this information is not integrated, the kind of care this patient accesses might be compromised. I would be giving one medicine without noticing they have another underlying condition. So what if we had an integrated health information management system that is accessible, that is the interoperability of these systems? As a pharmacist working in the pharmacy, as a clinician working in the clinical wards, as a mental health practitioner working in either the social setting or in a psychiatric station, and even with the medical lab persons, we can integrate this information such that when I'm offering counsel as a pharmacist, I have the right information and the comprehensive information about the patient. And therefore, even in engaging with the patients on what tests to be performed in the lab, what kind of interventions need to be delivered by the psychiatrist, or even the medicine that I'm dispensing and the follow-up metrics in terms of medication monitoring, I'm able to know this is the information. If there's any change in the patient vitals or the patient criteria rationale, I'm able to assess it and make an informed decision rather than making a decision based on partial piecemeal information that was given to me. And those are key areas that can enable us to support patients regardless of where they are, but based on who are they easier to access. For example, when you talk about the integrated health information management system, I would be a pharmacist attending to the patient in my location in Kenya. The patient might have traveled, let's say, for example, to South Africa. But then we have an integrated health information management system and interoperability with a particular psychiatrist in South Africa who would be able to access the same information for the patient and then intervene on my behalf, or even we have teleconsults and agree on the best course of care for that patient. It doesn't have to be cross-border. We can even start from the local countries within where we are. And we make it advance over time and reach to the patients who desire to get the best outcomes out of our interventions. So those are some of the areas that I feel we can deliver services, and I hope you have pointers on how we can work together and champion for this together. Thank you so much, and back to you, Hemi.
Thank you, Dr. Odhiambo, for an excellent presentation. No wonder, while you were talking, I was thinking that there's no wonder that you won the international contest. Congratulations for your presentation and for your award. We have a lot of time for the Q&A part, and we already have some questions, very interesting ones. Please consider sending your questions to our speaker today. So we'll begin with Professor Tatuk, Dr. Alan Matthews. There are two questions from this attendee. The first one is, how can community pharmacists provide a collaborative practice with medical practitioners to provide pharmaceutical care in mental health conditions? And the second question is how to get proper non-dispensing remuneration for community pharmacists providing the service. As we know, the incentives for practitioners is of course very important. And I think this is a very important question too. So Dr. Odhiambo, please.
Thank you for that. So I'll start with the first question, looking at it from how can we work collaboratively with other medical practitioners to deliver mental health services. I believe the key aspect for us collaborating with others is first, identifying what interventions we have. And from the presentation, I've already made it clear in terms of what can we do as pharmacists. Once we acknowledge these services, within the area of practice where you are, how many mental health practitioners and specialists do you know? Can we establish kind of an agreement, collaborative agreement with them, looking at, you always take care of these particular kind of patients. Some of the times they might not get to you, but being most of the times, as I mentioned, the first point of contact being the community pharmacy. They come to you as a community pharmacy in your setting. So once you diagnose and you feel there's a severe condition in this case, can you then now refer them to the mental practitioners? So you have to have kind of a repository of mental health service providers or institutions, one, and the deliverables for you is, in case I get patients that need specialized services that are not within my purview to offer, I'll refer them to you. That is a key bit. Then once you've established that engagement, as well for them, they normally don't dispense the medication. So as a pharmacy, you'll be dealing with the medicines. And if they diagnose a patient who needs medication, then they need to be referred back to you so that you have a collaborative engagement where you've identified the patient has a condition, you refer to them for advanced specialized care, but at the same time, they come into medication for you. So that collaborative engagement where you are addressing the therapeutic medicine, therapeutic aspect, they're addressing the clinical care component, and then now you can compare notes and establish a treatment plan. But you have to know, what do I offer? What does this person need from their end? How do we collaborate in that framework to ensure we bridge the care gap, but at the same time, deliver the intervention the patient needs? Rather than letting them be referred to us as pharmacists, we wait. When they've been diagnosed, we'll be waiting for a prescription, we'll fill that prescription and let it go. We need to bring on board what are our services. And I'm linking that to the second question in terms of the incentive for the practitioner. Once you've identified what services we can offer, as community pharmacies, whichever places we're working, can we design a service charter? And the service charter would outline the scope of services we offer, the remuneration for the same, and now through the collaborative engagement with other mental health practitioners, we can even engage with the, let's say, for example, stakeholders like financing institutions, health insurance, the national health insurance schemes. Once we have that kind of an agreement, then we now make it clear, we are all committed to delivering quality mental health services to our patients. For us to be able to do this, we have an agreement within the service level agreement within the practice domain, and therefore, to finance this access to care, the patients need the services. An insurance agency will ensure the patients who need the services, and the incentive for them is, am I able to insure patients for the key decisions and the care they need? Yes. If that is the case, then they will be able to give rebates and insurance rebates to community pharmacies offering these additional services. So the starting point would be, let's have a service charter as community pharmacies, as pharmacists, on what mental health services we can deliver. Establish service level agreements within our practice domain with multidisciplinary teams. And then using that, we have an ally base with our colleagues within the practice. Let's champion for a policy imperative that would help the governments to ensure to have insurance policies covering mental health services. other insurance, the private insurance also to be paying for this. And the other bit in terms of financing, there are different global health projects that are ongoing. I mentioned something on Wellcome Trust. They have a project on mental health and they have financing mechanisms. Imagine if as a community pharmacy in your area of practice, you designed an intervention that would be looking at, can you do research and at the same time model such kind of best practice in mental health service delivery within the community? You can, it can be grant funded, yes, but it's generating new evidence, new science, new route of knowledge that is going to shape the future of mental health delivery that is driven by community pharmacy or even pharmacy in the area of practice. So those are key interventions that we need to think of and open our minds to. What are the possibilities? What are the dynamics we are operating in? Then make it work for us in championing for a better practice. I hope I've answered you for that.
Well, I think so, yeah. Thank you for your very interesting and complete answer. There's a lot, way more than we can do for patients and healthcare systems. And well, you provided a very complete answer. We have next question is from Masaki Maehara. Sorry for my pronunciation. I'm sure it's pretty bad. So the question is there any specific strategy to detect patients with mental health problems in community pharmacies? He suggests either with a questionnaire or during medication counseling. I feel it's very natural for us to detect those patients when dispensing the medicines, because of course we know what the medicines were prescribed for, or the group of medicines we are dispensing. So do you have any message about that, how to better detect patients with mental health problems?
So diagnostic criteria, generally we have the DSM-5 and ICR-10. So these are diagnostic manuals that we normally use for diagnostic of mental disorders. So once you can access them online. Actually, there are guidelines on how diagnostic can be done. And mostly it's based on questionnaires. So how do you assess the patient from the presenting complaints, the pointing factors, the contributing factors and all that? Then you classify based on the scale that is provided. So there are manuals that are in place and there's no clear, like we say, this is for pharmacists. The DSM scale diagnostic statistical manual 5, that is the one that I'm more versed with. It's more on how do you diagnose the patient who have a mental disorder? What are the interpersonal challenges, the psychosocial challenges that they may be feeling? Are there any somatic problems that they might be experiencing? Then how do you grade them on a scale of 1 to 5? Then at the end of the day, you do the computation based on the module that is provided. Then you can assess whether they need extra help or you refer them to some other person. So, but at the end of this, like maybe I could share the link to the DSM-5 and ICR-10. Yeah. Okay.
Thank you. So we have many questions coming. Thank you for them. I will group 3 of them from different attendees. So the first one is an anonymous attendee asking how can community pharmacists, you provided some information about that, but he or she is interested in knowing how we can better help patients navigating with different technological solutions, especially I would say when not everybody is digitally literate. Another question comes from Mark Norte. The question is, digital technology solutions offer great promise in advancing mental health services at the community pharmacy level, as you very well said. Considering that mental health is faced with the scourge of stigma almost everywhere, how do we ensure data privacy, which is very important, and that confidential patient information and data are preserved in this era of data leakages and cyber threats? And I will add the question from Luna Elvisri, who's a dear friend of mine from Lebanon, a very active pharmacist. She says, digital health is key, especially during pandemics and crises, but how can we establish interoperability if in the country there are no laws for electronic medical record adoption across all health systems or cooperation between different stakeholders? This is an issue community pharmacists normally face worldwide. It's improving. FIP is working towards improving the interoperability of the software and the digital health tools that we are using in pharmacy. So do you have any message to our 3 colleagues from different parts of the world?
Okay, thank you so much for that. And thank you for the questions. Being focused on the digital health, one thing that we have to acknowledge that digital literacy is not everywhere. Not everybody is well equipped in terms of use of digital solutions. So that is one of the key bits that we have to acknowledge. And when you look at digital solutions, there are some of us that we would say, like, we're looking at the advanced case using, let's say, for example, the teleconference and all that. I give an evidence. My mom doesn't know how to use Zoom, so I'll have to call her on a normal phone call. So in that case, that is where now we look at what are the low-tech solutions. Currently, when we look at the global reach of, let's say, for example, WhatsApp messaging, almost we have like 60% to 70%. Can we just use the messaging, convenient messaging? Kenya, as an example, we have these kind of the feature phones having messaging options. How are we using them? For example, when we look at the financial technology, the fintech solutions, we have feature phones being used to remit money, and actually banks are facing challenges because just of a feature phone that is working as a funds transfer mechanism. So it's about not looking at the high-tech solutions, high-tech technological solutions that might only be a preserve for the few. But how do we democratize access to these digital solutions to the most underprivileged people and making it be accessible to them? And that could be through shortcode USSD, the shortcode messaging and all that, even the WhatsApp messages. Facebook even can be used now with feature phones. If we're talking about being able to converse with them through Messenger, through WhatsApp, through having a WhatsApp or Facebook group page where they can interact. So we need to look at not only going beyond, I would say, not only going for the high-tech solutions, but going to the low-tech technologies and ensuring we reach the patient that we are targeting within that space. And I can assure you, we are not going to be able to use one type of technology to access every patient. Even in our own domains of practice, we don't use the same kind of technology. Somebody will be using Microsoft Zoom, some other will be using Microsoft Teams. So how do we optimize to address the patient that we are keen on delivering a solution to? So you have to do your market targeting and identify the patient group you need to deliver solutions to. That is on one end. Then the other bit, actually, even just before I go to the other bit, when we look at the digital solutions for the people who might not have access, another key bit would be on literacy. Maybe you are texting and some of them don't even know how to read and write. And therefore, that's a challenge. What solutions are being implemented? I can give you a case of example in Uganda, just west of Kenya here. Uganda, there's an NGO, Living Goods, that is working with communities. So they have community health workers. Community health workers will form communities and interact with patients within the local community who might not be literate. But through that intervention, they're able to capture the patient-specific data, report that information through the care chain, and ensure that patients are able to access the quality of care they deserve and they need at that particular point. And that has become a growing interest in how can we leverage on the capability of our community healthcare workers and community health volunteers to deliver interventions and solutions to communities that are not often reached, but they need to be reached because they need access to quality healthcare services. So how do we kind of look at what are the different dynamics and interventions we can deliver? And AMREF is currently delivering on such. Actually, in Kenya, they have a model that they're working on within the Kajiado County and Marsabit within the nation south. Those are areas that we can also explore. And community pharmacies being within the communities where you work, we might not even need the community health workers. You can have an engagement where they can come to you as the referral point and the coalition point, where you interact, offer the services, and you report through digital technologies to specialists who might not be in the rural community where you are. And that can still deliver that care through the digital technology. You'll be the expert being the point person for them. Then the other bit would be looking at, there was the data privacy. When we look at privacy, we have to acknowledge that generally, globally, the data laws are not as robust as we would have expected. And therefore, data privacy issues are still a hot topic, especially within the healthcare space. And that's why now most of the focus has been, how do we ensure our data is being used for the particular reason it was specified to be used to? And that is upon us as professionals. We understand the challenges that come with sharing patient data with people who, for the reason that we did not specify to our patients. So what responsibility do you take as a practitioner to ensure that you are able to serve them without infringing on their data privacy, infringing on their rights? Once you're able to do that, that would be a win. And two, within our areas of practice, I mentioned the aspect on advocacy. These policies that are looking at governing sharing of data, use of data and all that, it is us individuals who are making them. What is your role as a pharmacist who is serving patients in protecting them by ensuring you advocate for robust data policy and data governance structures? Because even in pharmacy, we deal with a lot of data. For example, let's say, for example, I now issue you an inventory management system. and issuing you that inventory management system, I would not make it clear for you that I'm giving it for free to get data from you. You would feel like this person is generous enough giving me a device. But at the end of the day, behind the chain, I'm mining your data to know how many patients bought these kind of medications. Were they prescription or over-the-counter sales? Then from that, I could be targeting my own marketing interventions. So you have to be clear and be cognizant of the fact that not everybody will be keen on protecting the patient privacy and patient rights. So are you vigilant enough to identify the probable breaches? Are you able to champion for the governance structures to be in place? And are you able to promote the patients? But at the moment, I know it's still a conversation that is ongoing, and we have to be actively involved to be able to be part of that framework. And that is linked to the second question when you're looking at the interoperability of systems and all that. It's key, yes, interoperability is a critical bit for us to ensure we deliver on the solutions, and that is still on the policy to ensure we have frameworks in place. But other than frameworks, there's something that we look about in terms of trust. For us to be able to collaborate and share information, we need to build trust. And being a regulatory affairs professional, I could tell you about the current ongoing advances in the African continent. We are talking on African Medicines Agency. When you talk about a common regulatory platform within the continent to regulate medicines, then it means there has to be trust, and people should be willing to share the information with these regulators that is going to span the continent. And the same medicine should be approved in other countries. European Medicines Agency, EMA, is having a regulatory harmonization framework that is already working. How is it that in this particular region, there is a framework that is in place that people can access information about the medicine that are registered in each of the countries with ease across all the European countries? If that exists, then what do we need as stakeholders? And one of the key bits that I can mention about that is with the work we are doing with African Pharmaceutical Network. Can we come together as stakeholders? I don't need a policy to shape the conversation, but I need you as an individual where you're practicing. Let's say, for example, in Kenya, somebody's in Ghana, somebody's in Nigeria, Egypt, South Africa. Can we share information so that we have a best practice sharing model? Then once we build that trust and continue delivering care, it means we can design an intervention, a solution that can connect all of us. That platform that connects us can be a mechanism where we share information, we engage with others, and now with that model in place, we shape the conversation towards having a common regulatory framework on data. And most of it has to be shaped by the industry. Policymakers are not in the field, they're not practiced, they don't know challenges we feel, but it's us who know them. And one of the key examples that I could give is the one on Microsoft. I read this book by Satya Nadella, the current CEO, on Hit Refresh. What are the models of practice? When they are going into cloud computing, they know what they are working towards, they're innovating it, but as they innovate it, they ensure that they need to protect the general public and the use of the public data. And therefore, they interface with policymakers and regulators to ensure they understand what they're working on, they understand the scope of what cloud computing can do, and therefore they have a framework that is driving towards that end, rather than having either regulations and policies being inhibitory and curtailing innovation, but at the same time making it be responsive and actually being market driven. That is what will give us the solution we wish for, rather than waiting for things to come into place. I hope I've answered you with that.
Yeah, very, very interesting. Thank you very much, Dr. Odhiambo. My personal thoughts, what you were talking is, I myself, I'm providing some digital tools for my patients, specific digital health tools, apart from general messaging and so on that you talked about. And what I do personally, I try not to see technology as a black box. I try to really understand what I'm providing to my patients. As with every medicine I dispense, I try to understand and try to know in advance before doing that if it's going to be safe and efficacious for my patient, as with any other product. And related to data leakages and data privacy, we have a responsibility in that, as you said. And what I do, I only use tools from trusted providers. I read very well the legal claims before providing them to my patients, because of course we have a responsibility in that. Thank you very much. The FIP is also working, trying to improve the pharmacists' digital literacy, and there's a brand new course open to any FIP member about digital health solutions, and it's available for any FIP member. And I had the pleasure and honor to participating in its development, and I think it's very interesting. So I would encourage you to have a look into that. So we have many questions. Thank you. I will try to go to some specifics about drug-related problems, which you mentioned very well in your presentation. So can you build a little bit more on that? How can pharmacists play a better role in drug-related problems? And we have many questions specific to different therapies. And one of them caught my eye with saying that how come monitoring of adverse drug reaction associated with antipsychotic drugs be optimized with the use of digital drug services? Of course, this is a very specific question, but I thought it might be interesting. Maybe you have a message for our colleagues. If you want to build on that, please.
Mm-hmm. In terms of using digital technologies to manage adverse events, right?
Maybe not to antipsychotic drugs specifically, but are you aware of any digital health solutions that can address drug-related problems?
Currently, no. I don't have any idea of any digital tools that are existent. But what I acknowledge is by using one of them, I would say the example that we had with the Theranos, that was a model that we are hoping would help us, because when we can get your samples from you at any one moment and get it transmitted for testing, that would be a key bit. But at the current moment, what I acknowledge is the fact that we have to last with labs that can monitor the drug levels and even identify the therapeutic adverse events. Then now the key bit is that in relaying that information and making it accessible for us to intervene, because at the end of the day, there's still human intervention that needs to happen. So that is as much as I can say, but not a particular digital tool that I know in place.
Oh yeah, we have, if I may add, my personal takes on this as a moderator. I'm sorry because I'm using my privilege a lot. So there are some wearables that can detect maybe changes in the movement of the limbs that can support healthcare practitioners and patients to have a more autonomous life. And as you said about Theranos, yesterday I was reading on Twitter a colleague from Canada that was talking about the ability that community pharmacists have in some jurisdictions, not only to read the lab tests, but also to order them paid by the health insurance, just to have some reassurance of potential drug related problems. So there's many things that we can do. I know, and we know that community pharmacists are driving at different speeds worldwide, but we don't have to be focused always on the very high tech, as you said, or the very complex, specific professional services. There's always something that we can do for our patients, and we have to try and to be there for them and walk the extra mile, which you also said in your presentation. So I think that we have come to an end to today's webinar. I would like to thank all the attendees for their many questions and for using your very valuable time to be with us today. I hope it was interesting to you. It was very interesting for me. I have many interesting information. I feel now I'm better, have a better understanding of community pharmacy practice, thanks to Dr. Odhiambo. Again, congratulations, Dr. Odhiambo, for your award, for being our 2021 Champion for Change. And you will have, all attendees will have an opportunity probably during this summer to be our 2022 Champion for Change. And it's just a matter of finding some time in your busy schedule to answer our questions, and maybe you will be here with us in 2023 presenting to an international audience. So with that, I will close the webinar for today. Thank you for being with us. Bye-bye. Take care.
Thank you so much. And just to mention as we leave, actually, mental health is one of the key pillars of the FIP Pharmacy Practice Transformation Program, one of the 5 entities, and currently there's ongoing work in the design of the mental health toolkit that is supposed to guide pharmacies on how they can deliver interventions. And I'm hoping when it's ready, you guys will have access to it, and we'll share that information to optimize our care in the mental health space. Thank you so much for that.
Yeah, so there's a lot of opportunities for active pharmacists to be involved in trying to improve pharmacy worldwide, as Dr. Odhiambo, who's an excellent example of knowledge and active role towards the profession. And the FIP provides a platform to all of you for your personal development and international networking. Again, thank you for being with us, Dr. Odhiambo. It was a pleasure to have you. Bye-bye. Take care.
My pleasure. Thank you.